Hey ma'am, I'm Kyla Bruno, and for today I'm going to demonstrate newborn resuscitation or neonatal resuscitation. For the preparation, we should have self-inflating bag and infant mask. Next, we should determine the age of gestation. So now let me check the record of the patient. Okay, so the infant's AOG is 34 weeks. Now, we will assess the following such as breathing, muscle tone, color, and heart rate. Okay, so the newborn babies appears to have pink trunk and blue hands and feet. Pulse rate is less than 60 and does not respond in my attempt to stimulate her. She also appears to be limp and taking slow gasping breath, so my score is 2. Okay. Next, we will provide warmth by considering use of warmer. So let's imagine that this is a warmer and then keep the delivery room warm, so it should be 25 to 28 degrees Celsius. Now we will dry the baby using a towel. So it should be from head up to the toes. And then next, warm linen, cloths, blanket, sheets, hat, and clothes should be available for the baby. So, okay, so stimulate the baby now by gently rubbing the back, and remember, do not flick, slap, or stroke the baby's feet. So, but before that, let me swaddle the baby. For the open airway, place the baby on her or his back. Remember, when you are positioning the baby, it should be slightly extended. Use a rolled up piece of towel under the baby's shoulder and it may be used to extend the head. Okay. So, start suctioning. So in this case, the baby is having a difficult time to breathe. So first suction the mouth and then the nose. So now we will proceed in initiating ventilation. Still position the baby's head with open airway. So we will cover the mouth and nostrils with mask. Okay, so now I will squeeze the bag 40 to 60 times per minute. 4, 5, 6, 7, 8, 9, 10. 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 44, 45, So as I can see, there are no chest movement. So now we will check the mask seal and ensure that it is covering the mouth and the nose. Okay. And then we will reposition the head. And then reapply the mask. Okay. So check natin. And also, check for blocked airway, and kapag may secretion, of course, we will do suctioning again. And then after that, after checking it, continue bag and mask ventilation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, Again, position the baby's head with an open airway. Now we're gonna be using the tube and mask. So we will cover the mouth and nostril with mask and ensure a good seal. So let's imagine that this is the tube. So now we will squeeze the tube 40 to 60 minutes per minute into the tube by blowing into it. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, So, watch for chest movement, and if there are no chest movement, check the mask again, reposition the head, reapply the mask, and check for blocked airway and suction. Now continue tube and mask ventilation. So, still the baby is not breathing. So now we will do a chest compression, and we will find the lumbar. Then use 100% oxygen. Compression depth should be 4 cm. So we have 2 ways in performing chest compression. The first one is lone rescuer, which is a 2-finger technique, and then the other one is the 2HCP rescuer, 2 thumbs head and circling technique. So the technique that I will be using is a lone rescuer, and the ratio is 30:2. So continue giving set of 30 chest compression and 2 breaths until you notice a sign of life, and until you have performed approximately 2 minutes of CPR. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 33. 1, 2, and then 1, 2, 3, back. 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 So after that, okay, so as I can see, the baby is breathing and there is a heart rate. But if the baby is not breathing and the heart rate is not okay, you should now give medication. After that, document the procedure done and then the outcome. So that's the whole procedure on how to do neonatal resuscitation.